Namaskar and a very warm welcome to the 13th edition of the Phone-In program. I'm Nidhi Kumar and you're watching India Science. In a worrying development, India saw a single-day spike of more than 1 lakh COVID-19 cases on Sunday, the highest since the pandemic began. India's vaccination drive crosses the landmark of 7.4 crore doses administered across the country. The virus is back, but this time with more energy, tactics and camouflage. We don't cough. There's no fever. It's joint pain, weakness, loss of appetite and COVID pneumonia. The strain directly affects the lungs, which means window periods are shortened. The nasal swab is often negative for COVID-19. In this phone-in program, friends, you can ask your questions. We take your queries live. We are joined today by Dr. Kapil Kochhar, MBBS, MS, Additional Director, Department of Minimal Access, Bariatric and General Surgery. Many thanks for joining us today, Dr. Saab. Namaste.
Namaskar.
And thank you so much. How worried are you, Dr. Kochhar, when you look at the numbers which are indicating the second wave?
Extremely worried. And each one of us should be extremely worried. The problem is that the lull that came in the COVID cases, people have become absolutely...
The lull came between September to February, right? Yes.
And people are absolutely careless now. They feel the COVID has already gone. But and some of them have a feeling that even if it comes back, maybe it will be something like a situation that it was. Unfortunately, it's not going to be like that. Wherever in the world the second wave has come, it is more deadly, it is more devastating, and the infection rate and the morbidity and mortality rates are very high in the second waves. And I don't expect anything different happening in India.
What is the strain 485G? What is this variant? How deadly is it and why so?
See, from the data which is available till now, this strain is at least 30% more virulent than the original one. The mortality rates are higher. Even the people, like in earlier wave, we used to have that koi baat nahi, it's asymptomatic, it will pass off. Those kind of patients are very less in this case. Most of the patients are becoming more sick, and latest and the worrisome part is that the last wave almost escaped the kids without any problem.
Yes,
the kids were,
yes, it did.
But in this wave, the kids are getting equally affected. As young as 7 years, 8 years and 12 years.
Those are kind of cases coming to you. Meanwhile,
coming.
we are joined by our first caller, Dr. Saab. Namaste, Saurabh ji. Welcome to India Science. Please ask your question.
So,
he joins us from Delhi. Yes, Saurabh.
My question is, how can health workers while working deal with the second wave of infection?
Could you please repeat that? There is a lag in the audio. How can health workers?
Ma'am, my question is, how can health workers while working deal with the second wave of infection?
Okay, Saurabh, just to tell you that even if you are a health worker or even if you are not a health worker, the precautions and every other thing remains same for all of us. Being a health worker, you are definitely more exposed to the virus, so you need to be more and more cautious about the things. The precautions are the same. It's the wearing of mask, washing of your hands, and avoiding all unnecessary travel and gatherings. You have to be very strict. That feeling that kuch nahi hota, that has to be given up. It can happen to anyone, anytime.
Dr. Kochhar, there is this kind of negative attitude in our country where people are still thronging for holy functions, they're still thronging at India Gate, they're still partying. Even though they're wearing the mask, even that can be very dangerous because the infection is very viral and the virus is smarter than any of us.
See, why that has started is, again, as I said, that because the wave of COVID, the COVID cases dropped. So people have become little...
And the pandemic set in and the people, fatigue.
Yeah, the people thought that it's over now. So that's why the holy functions, the religious functions, the public gatherings and all those functions have started coming back. If you see the election rallies, they are full of crowds. If you see the holy crowds, if you see the markets, if you see all other places, they are absolutely full. You go to the roads, you go to the markets, you cannot find a place. So again, things have to be brought back to something what we saw in the lockdown. Although I don't think
a minimal lockdown needs to be, yes.
See, the lockdown, last time it was imposed because people never knew how to deal with it.
Yes.
Now everyone knows what has to be done.
And yet.
And yet. So if it's an individual lockdown, if it's a personal lockdown, it serves the purpose.
We have a caller from Maharashtra, Mumbai, Rupa Shukla. Namaste, welcome to India Science. Please ask your question, Rupa ji.
Namaste, ma'am. Namaste, sir. My question is, a number of chief ministers are saying we don't want to go in for a full lockdown, like particularly in Maharashtra, which is turning out to be one of the hotspots. The government is saying, look, if it's not going to be contained, we may have to go in for a fresh lockdown. I mean, do you think that's a good idea, another lockdown?
See, as I mentioned just now, that a complete lockdown, as we have seen in earlier experience, and that is not only in India, all over the world, a total lockdown doesn't work. The society cannot work in a lockdown. But the last lockdown definitely helped us because it gave us time to improve our facilities. It gave us time so that the people are given enough knowledge about the disease. So I don't think so that a complete lockdown is a good idea, and neither it will be imposed. But in case all of us, each one of us follows that principle, what we are doing in lockdown, we reduce unnecessary things, I think the purpose will be solved.
It appears to me that people want a lockdown. Pooja ji, thank you for asking that question. The next question is again on YouTube, and we're taking that from our YouTube live. And that is that how do you see Delhi will be going for a lockdown? As we speak, Dr. Saab, the Maharashtra government has this morning given the orders for malls, restaurants, hotels, all to be shut, not partially, shut throughout till further notice. So people are now asking, you see, they are intelligent people who are wanting so that thronging is avoided by people. And what do you have to say to that? What is your...
I'm not aware of this order because till last evening what I read was a partial kind of a lockdown.
Yes.
As far as Delhi is concerned, I don't think so that kind of a lockdown is around the corner. But yes, a partial lockdown will be there.
In the containment zones.
Yeah, if people don't understand this language, then government doesn't have any option but to go in for that.
Correct.
But that's not a good idea. I must tell you that's not a good idea. Self-discipline. Once we are self-disciplined, once we know that we have to wear a mask. See, mask is the most important thing. In last complete 1 year, we have been working in the hospital. I have been seeing almost 8 to 10 patients when the COVID was at peak, and we didn't even know that the person has COVID. Their relatives used to come, and by after the test, we came to know that, oh, he has COVID. He was posted for surgery. But all of a sudden, I find that he's COVID positive. And so must be his relatives. We were talking to them, sitting in a closed room. But since our masks were intact, all the things were being followed. So by the grace of God, so far, most of the doctors, they were saved.
A lot of them also lost their lives.
Yeah, but they were the frontline corona warriors.
Correct.
So that's really unfortunate, but then that's part of the duty.
We have another caller with us, Mukesh from Kochi. Namaste, Mukesh. Welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. So my question is, in the wider ambit, we are seeing once again the load on India's medical infrastructure, especially outside the cities.
Could you repeat that, please? Is there a load on medical infrastructure again? Well, that's a nice question for you to ask. I would like to answer that. Obviously, the reason is very obvious, yes. But why are we asking these kind of questions? I think you should ask questions related to the vaccine. Another caller is asking us on YouTube, could the second wave be possibly avoided? Could have been avoided. How? A very generic answer, I mean.
See, it's very difficult to say that it could have been avoided. Maybe some restrictions, if they were put on early, would have delayed it. But
Correct.
Totally avoiding a second wave, see, it's an airborne virus. We cannot shut off the entire country into an air vacuum chamber. So maybe it could have been delayed, maybe it could have been, like we could have been more prepared, but even nothing has been lost right now. It has just started. Let's start
and the
working.
second wave is not alien to the world. I mean, every part of the world is having a second wave. So how did we ever manage to dream or think or speculate that we will not have one?
Exactly. The same thing, bringing it down from the World Forum, I would like to say that how can we even think that mere neighbor ko ho gaya, mere ko thodi hua hai. So just shun that idea. This is a virus. It can affect anyone and everyone, right from the heads of the states, right to the biggest people, right to the poorest people. It will not spare anyone. So just shun off this feeling, just let this feeling go out of your head that mujhe kuch nahi hoga.
Doctor, we have another YouTube caller, and his question is that I had an allergic reaction after taking the vaccine. Now, is there something more that you see into this, or is this a common factor? Because a lot of people have been asking this question of some kind of a reaction after the vaccine. Is it a good sign that the virus is actually forming antibodies?
No. See, first of all, we need to know that what sort of allergy reaction it was. If it was, say, a minor soreness at the vaccination site, if it was a fleeting headache,
or a
if
flu.
it was something like that. So I don't call it as an allergic reaction. That is just a normal reaction that the body is reacting to the vaccine. Allergic reactions which are really serious, where we will say that, okay, you are not going to take the second shot of at least this vaccine. They are like when the patient's BP falls, when the patient has to be given immediate medical care.
Correct.
Yeah,
Which is why they keep you in observation for
yes,
half an hour.
that is why they keep you in observation for half an hour.
We have Meenal from Nagpur now.
Hello.
Namaste Meenal, welcome to India Science. Please ask your question.
Ma'am. Ma'am, I want to ask why many people have become infected with coronavirus after being vaccinated.
I couldn't.
We couldn't hear. Please, can you be a little louder? There is a lag.
Why many people have become infected with coronavirus after being vaccinated?
See, what she's asking is...
She's got the COVID-19 after taking the vaccine.
Now there are two things to it. One is that if you are asking about a COVID infection occurring due to vaccination, and the other part of it is that a the COVID infection occurring after the vaccination. So there are two different things. There are very, very sporadic cases where people have developed COVID due to the vaccine. But people developing COVID in spite of the vaccination, there are people, and it was never promised that vaccine will protect you totally like a total shield against the virus. But the advantage of taking the vaccine in spite of that is that, God forbid, even if you have infection after the vaccination, the severity of the infection is going to be less. And this holds more value, especially because the second wave virus is more dangerous, more lethal. So, vaccine has to be taken.
Correct. There's another question which is quite similar, doctor. Should I take the vaccine because I'm allergic to penicillin? She's asking, a caller on YouTube.
Yes, you can take the vaccine.
You can go ahead with the vaccine even if you're allergic to penicillin, but do inform the...
Yeah, you have to fill in the form that you have allergy to penicillin, and you have to be there in the observation after taking the vaccine. The vaccines are very safe. Let me reiterate that.
Absolutely. We have Anita joining us from Hyderabad. Namaste Anita, welcome to India Science. Please ask your question.
Yes. So my question is, a lot of people I know who have taken vaccine are getting fever after that. So should they be taking paracetamol, or is it okay to have fever after being vaccinated is what I want to know.
See, we as healthcare professionals got the vaccination first of all. And what we saw in our early 2 months experience, that it's very safe and advisable to have a paracetamol. It will not affect the effect of the vaccine at all. Rather, it will keep you comfortable. In fact, in case if you ask me, after each shot of vaccine, I took a tablet of paracetamol every 8 hours, 3 doses, just to keep that fever off.
Or a Dolo.
Yeah, or whatever, like anything for that matter, because what we saw was that if the fever comes, then it's more distressing rather than not having it.
Correct.
So all of us took paracetamol as a precautionary measure. It won't affect the efficacy of the vaccine at all.
Dr. Kapil, just take a moment to make our viewers understand the sequencing of the positive cases that we are seeing in the country. What do you feel is the requirement for vaccination right now? If you look at the numbers, how do you think we'll reach the numbers as given by GOI?
See, the problem is that India is a huge country and the population is even more huge. So in spite of the fact that we have the good and the best vaccine facilities in the country, still we know that reaching each and every person is going to take a bit of time. But what is surprising is that people are talking about that when will we reach those numbers. But believe me, if I go to the vaccine centers, many of the vaccine centers say that there are not even 100 vaccinations occurring in Delhi. People are so scared of taking the vaccine. I don't know why. When there was no vaccine, they were craving for vaccines. And now when the vaccine is available, India is a lucky country. If you talk to other people who are living
They're
abroad,
waiting for vaccine, yes.
they are looking at with such eyes that when will the vaccine arrive? And here people are just not taking the vaccine for all sorts of foolish reasons that they can think of.
Yes. All sorts of myths.
All sorts of myths.
Whether it has a cow syringe to it or a
See?
cow serum to it. We're getting those kind of questions on a daily basis.
If you take your child for a vaccination, say a typhoid vaccine or a DPT vaccine, and you are convincing the child, "Arey, kuch nahi hoga beta, thoda sa dard, thoda sa bukhar," and when it comes to yourself, you are scared of slight fever. I guess the children should be taking their parents to
I'm
the vaccine
so happy
centers.
you're saying that. I'm so happy.
They should be taking, ki Papa kuch nahi hoga, Mummy kuch nahi hoga, vaccine to
Just
lagwao.
take this. I think like the Swachh Bharat Andolan, there should have been somewhere, the children should have been told and the things would have been solved, absolutely. We have a caller now. Anita ji has joined us. Namaste Anita, welcome to India Science. Please ask your question.
Hello.
Yes, please ask your question.
My question is, every doctor and government is talking about, following the basic COVID protocol. But we are not really seeing that happening, So is lockdown the only thing, is lockdown something that might become necessary at some point of time?
Do you want the lockdown, guys? I mean, you're not asking for it. I think you should start mailing Prime Minister Modi. He'd be very happy to take this question because things are really not working out, It's like, I hope each of us is doing the right things as far as protocol. Anything you'd like to add, doctor?
I would like to ask you one thing. That do you really think that the government or Modi or anybody, whichever part of the country, they want a lockdown?
Nobody wants.
No one wants a lockdown. And why will the need of lockdown arouse? It will arise because we are indisciplined. Let's talk about ourselves. Let me tell you, each one of us, including myself, including madam, including everybody who is watching this program, if they take this pledge that I am going to protect myself.
Correct.
If I protect myself, let me not care about the others, what others are doing. But on the contrary, what is happening, that even if I am wearing a mask and the other people are moving like that, to hell with the mask. If they are not wearing, why should I wear? No, that concept has to go. Each one of us takes a pledge that I will be protecting myself, irrespective of the fact
And
what
also,
others are
doctor,
saying.
we're having a lot of questions on our YouTube saying, Covishield, Covaxin, why shouldn't I wait for the nasal one? I mean, why are you waiting for the nasal one? What is so special about the nasal one? It's not even definitely going to be out very soon. So, what do you have to say to that?
People are just afraid of a prick.
Yes.
And the problem is that it's such a small thing, such a small injection, that it's basically they're trying to find a reason of not taking the vaccine. They're trying to postpone it. Believe me, the wave is already there. Even if you take first shot of vaccine, you get a significant immunity within the next fortnight. Please don't delay it. It's a request with folded hands that whatever good these vaccines are for, प्लीज यूटिलाइज दिस
मुझे लगता है या तो ये सियासत का करा हुआ है या फिर भारत में इतनी चॉइस दी जा रही है वैक्सीन्स की कि लोग पहले आप and they're waiting for the other person to take the shot, which is really sad. Meanwhile, we have a caller, Chandana ji. Namaste, welcome to India Science. Please ask your question.
Ma'am, my question is, the government has now started to extend the vaccination ambit, but still, there's a gap. Would you agree with that?
There's a gap for, I think 45 plus is already open since April 1. Sorry, I didn't get that question. Could you repeat?
The government now has started to extend vaccination ambit, but still there's a gap. Would you agree with that?
How do you attribute the gap in numbers? They want more people to be in the drive is what she actually means, like 30 plus and all that. Why don't you include all of them is what she, I think, means.
I think that's round the corner.
And
that's not going to waste any time. Very soon, 30 plus people will be included. It can happen maybe as early as next month.
But doctor, what do you feel about taking it homes to people who are, not in good condition? Health workers could perhaps go to their doorsteps and we could hasten this process. Somebody who is disabled, for example.
See, I agree with you what you're saying right now, but the point is that the vaccine is a very temperature sensitive vaccine.
Correct.
So, taking it all the way to the home,
It
number
might
one.
lose its efficacy.
Number two, the problem is that, as you mentioned, that we are keeping people in half an hour observation. So, in case there is an untoward reaction at home, it's going to be very difficult to be managed. So that is why. But maybe with more experience coming in, after all, there's a data assimilation going on simultaneously. If we realize that, well, the reactions are negligible, then maybe that step is also going to begin.
Somebody from Manipur has written on our YouTube channel that they've heard that something untoward has happened to someone who perhaps took the vaccine, a very different kind of a reaction or fever for continued days. So she's asking, should I take the vaccine?
Yes, you have to take the vaccine. These are very, very sporadic incidents. If out of 10,000 people, one person has this, you may not be necessarily that one person. Please take the vaccine.
So, what do you attribute the spike in Maharashtra to? This also is another question on the YouTube. As younger lot, as you mentioned, is being affected by it. What is the spike basically in Maharashtra? Why Maharashtra first is people asking?
See, what I can think of is that Mumbai being the capital, the industrial capital of India, the business capital of India, see, after all, the strain has come from abroad. Even the first strain and even the second strain. So maybe
whether it's Brazil, UK or Africa.
So because of the more influx of people from abroad, they have brought in the virus. There is no doubt about that part. So because there is more of an international movement over there, so it's began off there. But believe me, rest of the country is not going to be far behind. It's already occurring in Delhi. It will
11
be very
states,
soon.
doctor.
Yeah,
it's 1 lakh cases
each
today.
Each and every place will
1
be
lakh
affected.
plus cases
If
today.
we don't become careful now, each and every state will be affected.
We're joined by another caller. Namaste, welcome to India Science. We have with us Rakesh from Lucknow. Rakesh ji, पूछिए अपना सवाल.
गुड आफ्टरनून मैम, गुड आफ्टरनून सर. सर मेरा क्वेश्चन है.
We've lost you, Rakesh. Could you please repeat? We've lost the line. Meanwhile, till Rakesh joins us, you were specifying why Maharashtra only. Could you go into more details? Because as far as the Dharvi slum area was concerned, India did manage to, pull that through. I mean, we controlled it in the worst places. You have lots of people living in small containment zones in Mumbai, doctor, and they are the slum areas.
Was a nightmare even before the COVID became widespread.
Correct.
It was considered a time bomb.
Yes.
But it was contained in a very efficient
Wonderful
manner.
way, yes.
And it became rather a picture for the whole world to see that how it was controlled. So again, what I feel is Maharashtra being like a lot of people coming from abroad, so it has become affected. And of course, Mumbai especially, it's a very populous state. So going from one place to another, the bars, the hotels and everything became normal. So that is the reason that why Maharashtra has been the victim first of all, but very soon I am sure all the states are going to have the same kind of
The numbers
picture.
will probably
It will
double
be the
up in a
same
week.
because
Yes.
and it will be quicker than the last time because the virus is more strong.
Absolutely. Rakesh joining us from Lucknow once again. Namaste, Rakesh. Welcome to India Science. Please ask your question.
Sir, are you seeing in your own set of hospital any indication of this spike, any growing pressure?
Are the hospitals seeing growing pressure on COVID cases? Are there enough hospital beds? That's what I would like to add to that. A lot of people have been asking that. Are there enough ventilators or oxygen masks in Delhi, if we speak, or in your hospital, perhaps?
There are enough beds, enough hospital beds, at least as far as I know of the Delhi NCR region. Even in the last time when the COVID was at its peak, there were enough beds vacant, at least in the government setup. And as far as the number of ventilators and everything is concerned, they were a little short, but to be very honest, last time the wave was such that many people never ever required ventilators. As far as the wave this time is concerned, people are becoming more sick. How things will turn out to be, it will be very clear in next 10 days or so. But as far as beds are concerned, I think we have enough beds. As far as ICU beds are concerned, well, we will be seeing in the next few days. But I'm sure that since we know that this is going to be a more virulent strain, more and more of ICU beds can be created, not that there will be a shortage.
If we remember last time, Dr. Saab, we had stadiums that were turned into COVID facilities. Is the government having any plans to do this kind of?
If needed, it will be done. See, last time it had begun from scratch.
Yes.
So even then it
now
was.
Everything is in
Now everything
place.
is there. It
Yes.
only has to be restarted.
What about the common man who cannot afford a ventilator? There have been so many cases in the first wave, and people are writing in to ask that should the ventilators cost per day be lessened? Is there some way that can happen? Or, people also learned the art of self-quarantine in case they have COVID positive symptoms. So, in case of somebody doing that at home, does any hospital have facilities of sending them the oxygen and these kind of requirements which they may be having? Because a lot of people can't afford to be in hospitals. They're scared of going there for the others to contract the illness as well.
Nidhi, let me clarify that. Even last time when the waves were there, the government had fixed the price. There was a capping in the price of the hospital admission, and government hospitals are always free.
Yes.
There was no doubt about that. Even my personal patients who were admitted under my care, if they could not even afford that much, the capping price, they were immediately shifted to government facilities, and the function was absolutely smooth. I can vouch for that.
I'm so happy that you're saying that. We have Sneha from Meerut. Namaste, Sneha. Welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. Sir, my question is, like my mother, she's 60 plus, she got vaccinated and she showed no side effects. While my sister, who is 45 plus, when she got vaccinated, she showed, like she had fever for almost 5 days. So why do you think that happened? In elderly, the side effect was not much. But with people who are slightly younger,
I know why you're smiling. I caught that too.
Very interesting question you have asked. This question we should ask to ourselves. This just shows that the older generation is even today healthier than the younger one. They used to do a lot more physical work. Today, I have yet to see a house where a person walks to the other room to talk to another family member.
Oh, it's an intercom.
They picks up the phone.
I'll tell you, my home, I talk to my daughter on the intercom.
Yes.
So, that's it.
Especially with the low call rates, they say, "Acha, zara pani ka glass lana yaar kitchen se." So, this is the answer.
Absolutely. There are some more callers asking in to find out, Doc Saab, about the SARS-2 virus and till when it may last. What is any date that you could give? A third wave, a fourth wave, possibly a fifth wave. I think Google and Facebook has confused people by saying 2025. So a lot of questions are coming like that. So what is your estimate as far as India is concerned? When can things go back to normal?
As far as my limited knowledge on this, speculation goes that the COVID virus is going to stay with us for a long, long time to come, but the epidemic or the pandemic part will be over. It will be like endemic. If you recall, many, many years back when dengue came, it was a devastation all around, number of deaths. Today, even if a person has dengue, acha dengue hua hai, koi nahi, theek ho jayega. But dengue has not vanished.
Yes.
It is still there. Chikungunya is still there. So similarly, it's going to stay just like an influenza virus. Year after year, it will come with a new strain. But I'm just waiting for the day when we have effective medicines to treat it. Right now, the entire focus is on vaccines, which is there to prevent it. But the day we have a
treatment in place,
I think it will be tamed like anything.
What about some questions that are coming in? चलते चलते आप ये जरूर जवाब दें कि ये वैक्सीन का क्या है after 2 doses. Will it be repeated after a year, after 2 years, after 6 months? ये भी पूछा जा रहा है.
The studies are going on. We are going to, like the blood samples will be taken, that how long does the antibody response stay? And in case the antibody response wanes off after 6 months or a year, yes, a booster dose of vaccine may be needed. And a newer vaccine which is more effective against the newer strains may be there every year. So it's nothing to worry. But in case, I still feel more than the vaccine, it's the personal discipline which is more important.
I think we should say something about washing hands. Would you please?
See, what I can say in general language is that even if you have vaccine, even if you have treatment available, say tomorrow for COVID, it's something like that if you have a wallet full of money. if you have a gold watch, if you have got a gold ring, I tell you that, okay, all these things are insured, in 7 days you will get your payment. Are you going to leave it carelessly in the bathroom or in the table? You will not leave
what
it.
a wonderful
Because
thing.
they are valuable to you.
Yes.
So treat your nose and mouth as your gold rings. Keep them covered, keep them protected, even if there is a vaccine, even if there is a medicine.
I'm really impressed by this,
You just keep it protected. That's it. The job will be done.
And in the end, I'd like to thank you, Dr. Kapil, for joining us today. And with this is a wrap on the 13th edition of the Phone-In. The rise in numbers comes as India has expanded its vaccination drive amid a raging second wave of the pandemic. We have to maintain the COVID protocols, stay safe, wear a mask and maintain social distancing. So, the wave is more deadly than the first. So, we have to be very, very careful and take every precaution. Stay safe. We'll join you again next Monday. Namaskar. Keep watching India Science.